Now, support coordinators and providers are asking me, is there a way for them to get a provider number and become a provider faster? I mean, or is that more have to go through APD? I know we got to go through AHCA for getting numbers.
Yeah.
It's, you know, kind of a switch back and forth type of thing.
Yeah, that's really much more coordinated through Agency for Persons with Disabilities. But if there are gaps in how that system is working that we can help with, I'll certainly be happy to work with Jim and the rest of his team to get that taken care
It
of.
just seems sometimes people call there, they tell them to call here, vice versa. So it's, you know, kind of a buck passing thing. That's why I thought maybe if there could become an easier way for them to be able to do that, especially when, you know, like when EDS switched and people had to get a new number for the FSL, you know, there was people that were waiting 6 months to get a provider number, but yet they're still doing services.
Yeah. Okay, so here are a couple of favors that I have. First, I mean, let's talk about, it would help me to know where the gaps are. Like, what is there something that is particularly confusing about what the information is that they're getting from APD or from us? And what always helps public servants is, can you give us a suggestion on how we can make it better?
Definitely.
Because if you want to outline the particulars, it's a lot easier for any one of us to route it through our system to make those improvements. But if we don't, a lot of times, what's frustrating about government is we impose systems on you, and you all think that you just have to live with it, instead of calling us up and saying, you know, I don't think this makes sense, and here's how it could make more sense. So, for all of your readers, viewers, if they have specific suggestions, we're always glad to hear those.
So ideas to make it better. Go ahead and send your emails.
Yeah. Well, no, I mean, please do. I should be realistic, though. The guy from my team who is overseeing the transition to EDS is a phenomenal human being and really does not sleep. We all get emails from him at midnight, at 3 a.m., at 6 a.m. I mean, seriously, the guy, like, I think he even emailed me maybe Christmas Day or maybe Christmas evening. So he's working around
very hard to try and get things working.
So some of what we want, we have to prioritize getting people paid the correct amount first.
Right.
So some of the enhancements will come next, but we need to get them in line so that we can address them when we have the resources to devote to the new improvements. Okay?
Great. Now, wheelchairs and other durable medical equipment are often an issue with a lot of different people, and wheelchairs are only covered every 5 years. Now, what if something happens, such as a wheelchair is stolen, damaged, or just doesn't fit the person's needs anymore? How do they get a new wheelchair or their wheelchair at least fixed?
Yeah, it is a complicated process, isn't it? I have some wonderful people in my field offices around the state, and there's a woman down in my Fort Lauderdale office who has pictures of all sorts of wheelchairs all around her office because we think it's important. I mean, it's a really important part of any person's dignity. There are a couple of things. We have to get, because you don't want the service to be abused, and unfortunately, for all of the good people who really need the wheelchairs, we have significant problems with fraud in the durable medical equipment.
Right.
And so, unfortunately, the bad guys have made it extra hard for the good guys to get the service, to get the equipment they need. You specifically mentioned a damaged wheelchair, and so if it is lost or stolen or damaged in a fire, you have to get a police report to help with some of that. And some of this may be, if we need to give you more specific instructions for that, or are you finding that people calling are not getting the information they need about wheelchair?
Exactly. They're just not finding out how to actually get it done.
Oh, okay. All right, so then it sounds like we need to make sure our call center agents are better informed, and then also on our webpage it's more clear about how to get the authorization for that. But all of these things, like a wheelchair, has to have a 1-year warranty. Wheelchair rules are complicated, and I could go through these long paragraphs that my staff has given, but it sounds like we need to give you a link for your webpage,
right?
So that you're a resource, and we'll also make sure that it's available on our webpage.
That way people have the information and be able to get that taken care of, because that is a very important thing for people to live their lives.
Oh, yeah, I don't know how people need to get around.
That's for sure.
Yeah.
Now, can you tell me about AHCA's efforts in fighting Medicaid fraud?
So there are always people who like to tell you that probably about of Medicaid billing is fraudulent or abusive. And I have to tell you that I didn't really want to believe that it was that bad. So within our agency, all the state agencies have something called an inspector general,
Right.
who is kind of your own they guard you internally and make sure you're being honest, but they also make sure that everybody else is being honest that you do business with. So within our inspector general's office, we have something called Medicaid Program Integrity, and we have a number of people who are they're really a lot of auditors, but they also go out and visit providers to make sure they're on the up and up. And so we have Medicaid Program Integrity offices and Inspector General offices in different parts of the state. I recently went on a trip with my Inspector General and some folks from Medicaid Program Integrity, and we went to Miami, and it was unbelievable. We went to a home health provider, and then we went to a durable medical equipment provider, and we started going through their books. And for all of your readers who really need that care, it is so disheartening when you realize that these providers are cooking up all these schemes where they pay their employees and they pay beneficiaries to get services that they didn't really need, like it's all this big scheme. Right? So they say, I'll pretend like I'm giving you care, and you'll get some money for that, and I'll get some money for that, and we'll just send the bill to Medicaid. So it's really crummy. But on our website, we are required by law, and that seems really small, but we went to this durable medical equipment place, and somebody needed an oxygen nebulizer.
Right.
Well, this durable medical equipment provider, out of the goodness of his heart, also sent an oxygen tank, which was not something that the doctor ordered. But he did it because for every month that they have that oxygen tank, we're billed $34. And it doesn't seem like that much, but when you think that they could be doing that to hundreds of their clients,
Right.
and it's
It
roughly
adds up.
So things like that really stop us from being able to spend all that money on the people who really need care. So if your readers know of instances of fraud that we could go stop, that really helps us. But online, you can also find our annual Medicaid Fraud and Abuse Report. Over the past 6 or so years, this agency has worked very closely with the legislature, putting much safer much stricter protocols to limit some of the ability to defraud the state. Last year, our big effort was to change the laws on home health agencies, to tighten the restrictions to get to be a home health provider, and also to give us some additional teeth to go after them. And what we're finding, since the law became effective in July, is we're seeing a significant decrease in the number of people who are signing up to be home health agencies because they found it's no longer easy
Just to be able to do that.
Yeah. So every day we're looking to target fraudulent providers.
Good. Now, many health plans state that they are the payer of last resort. For example, some people are covered by Medicaid, Medicare, the Medicaid waiver, and private health care insurance companies. Well, it may seem like they're lucky, to have the insurance or have the health care. It often only starts a battle of who pays it, who pays for what, often delaying the needed services that they have to have. Can you tell me, if you know, who really is the payer of last resort, and in what order do the other plans step in with payments?
We actually are the payer of last resort. If a person is paying for insurance coverage, that's typically you should pay first rather than the taxpayers.
Right.
So typically, those other payers are the first payers, right? The other third-party payers. Then you go to Medicare at the federal level. Then you go to other Medicaid programs, because we find, particularly up here, where we've got a lot of crossover from Georgia and Alabama, we may find that there are Medicaid patients who are coming into the state to get some health care. Oh, it's the air conditioner. For you. And then we finally look to waiver providers before we become Medicaid. So.
Well, good. That's good to know that you guys are actually the last payer of resort.